Welcome, everyone. I'm Dr. John White, the Chief Medical Officer at WebMD, and you're watching Your Health on Tech. The COVID pandemic has largely been an infectious disease respiratory pandemic, but the effects of the mitigation strategies, lockdown, social distancing, they've created a mental health pandemic as well. People are suffering from anxiety, depression, and PTSD, as well as a host of other conditions. In many areas of the country, there simply aren't enough mental health professionals to address people's needs. Telehealth and telepsychiatry can help, but even that is limited. What about different apps and digital tools? Are they adequate substitutes? What role do they play? Are you using them? Should you be using them? Joining me to help sort out the role of digital tools in diagnosing and managing mental health conditions is Dr. Meena Murham. He is an assistant professor of psychiatry at Columbia University. Dr. Murham, thanks for joining me.
Thank you for having me, Dr. White. It's a pleasure to be here.
I want to start off with these mindfulness apps. Let's talk about the role of mindfulness. We become more sensitive to its value during the pandemic. What role do these apps play?
I think a great analogy that you've posed at some point as well is these apps can be like going to the gym, right? You have to learn how to use mindfulness. It's a technique that can be very helpful. There is a good evidence base there that the practice itself can be very useful. However, much like going to the gym, you have to have the proper equipment and the proper supervision, perhaps, to know when is an appropriate time to use this app, when is a time where you might go to the gym and not know what you're doing, you might hurt yourself, right? So what we've seen in the data here is that there is certainly a role for these apps that can be a supplemental element of treatment. It doesn't replace treatment, it doesn't take over. However, they can be very helpful.
But in mindfulness, could I just read about it and do it? Do the apps make it simpler, especially the free ones where you don't have to pay a fee? What role do the apps play in mindfulness?
Certainly. Well, one element of that we have to kind of be considerate of when we're looking at these apps is one, some of the apps that sort of say that they're free, but over time they may charge you, so be aware of that. But the data is still a little bit early about effectiveness. There are some studies that have come out and said, well, it is somewhat similar to placebo as far as effectiveness of the apps. However, they can be a tool where you can learn to practice daily, because sometimes reading is not going to be as effective as learning to be present. When you're thinking about mindfulness, what is the way that I can be present in the moment and be able to be where I am without judgment, without looking at the situation in a way to sort of comment on it.
And the apps only work if you use them. So what's your prescription when we talk about mindfulness? Is that something we should be using the app every day, several times a week? What's kind of that dose?
A healthy dose is typically one that would be balanced in your daily routine, where you don't want to be using the app too much. For some folks I've had, if you're quite anxious and you become, the app can also be sort of a source of fixation or a sort of anxiety that if I didn't use my app today, I'm more anxious than I was before. So you want to have a balanced approach where it's something that you're using relatively frequently, 3 to 4 times a week, that allow you to check in on yourself, check in on your own mood. And that'll give you a sense of, in the middle of the chaos, especially these days we're coming back from reopening, that you can center yourself again.
Now we know with mental health, the first step is diagnosing. What is one suffering from? And many people ignore symptoms. Several of these apps talk about tracking mood or tracking depression. How reliable are they?
So in that regard, that's one of the pieces of data that we've seen that actually has been somewhat encouraging. When it comes to where the evidence is as far as effectiveness in treatment, the jury's still out a bit on that. There are some studies where we're not seeing that quite yet. Sometimes the apps will be a bit ambitious in terms of, well, this is an evidence-based app or an app that is using these practical tools that are just like seeing your doctor.
And many of them say they're not diagnosing disease, but then they'll use words like mood, which technically isn't a medical term, but people will interpret it to mean. So they may use the app and then think they don't have a problem when they actually do, and vice versa, right?
That's a very good point, because what we don't want here is that we want to caution folks that you don't want to go to an app for a diagnosis. You don't want to be putting in because some of the apps will do a good job of tracking your mood over time. We've come a long way with emojis or different ways that we can sort of express ourselves. And that data can be helpful once you use that in proper context with your clinician. You say, oh, here's what I've seen over the app. over the past couple of weeks. Here's what I'm seeing over the past couple of months. And you can take those data points and then come up with something relevant.
Now, talk therapy is a treatment option for some conditions. And many folks are saying, well, these apps can help with chat and talk therapy and text messaging. And there's even some AI devices where you're actually using a chat bot and not actually talking to a real person. What's the role of text messaging and chat in addressing issues of anxiety or even smoking cessation? We've seen that some areas.
That's a great question, actually. And I'm glad that you mentioned anxiety and smoking cessation in particular, because one of the things we want to be careful about is the nature of how acute what you're dealing with is. For example, you and I were even talking a little bit offline about someone who's very anxious. And sometimes part of the treatment in anxiety is frequent reassurance. If you're anxious about an illness, for example.
But can AI do that?
In some ways it can. That's kind of the thing, is that whether it's AI or a person who's going to give you live feedback and say, just reassure you, things are okay, you're doing okay, things are getting better. There's a role there. Again, the data is a little early in terms of how effective that is compared to a real life clinician, but you want to differentiate between this is not going to be your go-to for suicide. This is not your go-to for major depression where there's a risk involved or other psychotic disorders, but for anxiety disorder spectrums, like illness anxiety disorder, it can be actually very helpful.
But what about the fact, and I mentioned it, we're really in this mental health tsunami in terms of people suffering. Even with telepsychiatry, there are not enough providers around. I see that when I see patients in terms of being able to get an appointment. So how do folks determine whether or not they can use an app or they actually need to go see someone?
One of the reasons that the American Psychiatric Association has taken on this subject sort of head on is we're realizing there's no escaping the fact that people are going to go online anyway. That's part
Sure.
of what we have now, right?
Mhm.
The big question though is triage, right? You don't want to go somewhere, you don't want to go to an ER where you could have gone to your primary doctor. You don't want to go to your primary doctor where you could have just gotten reassurance from a friend. So the big question will be, if you're dealing with something that's along the lines of common mental health concerns, like generalized anxiety, like perhaps even panic, there's a tool that you can use called mindapps.org, which actually helps you categorize a bit through different filters and say, well, maybe this is a level of acuity that the App Store is not going to really help you. We should consider somewhere else. Because at the end of the day, the apps can only do so much. They're a great tool as part of a complete toolbox, but by themselves, they can sometimes do more harm than good.
But people can't always wait 2 to 3 months for an appointment. So how does that help assess in terms of, oh, hey, I really should be making that effort to see? Is there something that the app should be doing to say, hey, you should be seeing a professional for this, or something that you think up front? Almost like a disclaimer,
Right.
in a way.
In some ways, a lot of the apps will try to diminish their own liability by saying, listen, we're not going to be able to give you that diagnostic criteria and say you really should be seeing a clinician. They're going
And they say that now.
They do,
in many ways.
right?
They use different language.
They steer you towards themselves, which is part of the reason, right now there are over 10,000 apps in the App Store specifically for mental health. And over the past year, there has been an increase in people just searching even more serious diagnoses like schizophrenia and bipolar, which these things are really not appropriate to be managed through an app. So in a simple way, I would say if you're dealing with something that there is a safety concern, or if it's been going on for a duration of time, or really impacting your function, these are 3 criteria to think about to say, well, maybe an app is not going to be enough for me here. It can be a part of it, but it's not going to be my go-to.
And what are some of those criteria?
So in particular, I like to think about these 4 Ds. I like to think about danger involved. If there's something that is life-threatening, if there is an imminent risk here, that's not
You're
the
going to
time.
hurt yourself or hurt others.
Exactly. If you're going to hurt yourself or others, that's not a time to be going on an app, downloading from the Google Store or wherever it is, right? There's something more involved here. 2 is duty. If you're seeing a significant impact on your daily duty, meaning your function at work, at school, can't function really anymore, that's a bigger red flag to say, well, you know what? I really should be at least going to my primary doctor, at least going to perhaps an urgent care, or perhaps an ER even as well. Thirdly is duration. Has this been something that's been happening for a day or 2 or a week? If, as the old Friends show would open up, if it hasn't been your day, week, or month, or even your year, well, perhaps this is going on too long. On average, what we have data from NAMI is that between the time someone begins to have symptoms of mental illness and actually connect with care, it can be up to 11 years, which is staggering number. So that's why duration is key. And then lastly is depth, meaning how intense these feelings are. We may all have a little bit of a feeling of anxiety or panic here and there, but if the depth is such that you're feeling an impending doom and you're feeling like this is the end of the world, perhaps another red flag, another sign that says maybe the apps are not enough for me right now.
Some of these apps focus on gaming, and they say these games can help reduce stress and anxiety and help with mood. But I want to ask, just because there's been stigma with depression, we don't take it seriously, and other mental health issues. Does gaming trivialize mental health? How does it play into helping manage mental health issues?
Part of the stigma background here is that we would sometimes sort of have a black and white approach of saying you're either going to use gaming for recreational purposes or you're not. But the reality that we're seeing now is the gaming world is such that there is sort of competitive sports in the gaming world. There are people who are spending more time online, and it's not all bad. There are parts that can be used for connection, especially when nobody was going
Okay.
anywhere.
Mhm.
So I think
But for anxiety and depression and other things,
Well-
I should use gaming?
Well, I wouldn't say that particularly. For right now, the data is not such that we, even though as we'll mention that there are some things that the FDA has come out and said, well, maybe this one thing could be helpful. So the data doesn't support gaming to be a treatment modality by any means. However, as we've seen in psychiatry in general, is it a point of saying, should we avoid this altogether? Or rather, should we study it and see what is the potential role that might be helpful here? Yeah.
As you know, I worked at FDA, and I want to mention when we talk about gaming, the FDA has approved a prescription-only game for the treatment of ADHD in a pediatric population, ages 8 to 12, as part of a comprehensive strategy. Are we going to be seeing more digital tools, prescription-based, that are going to address mental health issues?
I really think so. And I think part of the reason is that in mental health now, we're seeing a paradigm shift where 50 years ago there was take this medication, you'll be better, or sit on the couch and you'll be better. But as you and I have talked about, this comprehensive approach now is redefining what it means to be medicinal. Food is medicine. Lifestyle is medicine. So in some ways, the internet, apps, or games can be medicinal when studied correctly, when prescribed in a comprehensive fashion. So to ignore that would just be a sign that we're behind the times. And I'm actually glad the FDA said, we're going to step up and look at this more carefully.
Right. But at the same time, and you and I talked about this the other day, a recent meta review in PLOS Digital Health looked over a dozen meta-analyses of over 140 trials involving 50,000 people. And they did not see much evidence in terms of effectiveness, and talked about major shortcomings. And maybe that's because we're all very critical in terms of studies. So where does this leave people today that are struggling with mental health issues, that are having issues in terms of getting an appointment? It could just because of availability and issues of insurance. What role do these apps play in maximizing mental health? Because we know there is no physical health without mental health. So we have to address mental health. Where do the apps come in?
Absolutely. And I think what this leaves us now is with cautious optimism, is that right now there is, even though there are wild promises being made by some of these apps in terms of how effective things are, the reality is the data doesn't match it quite yet. And what that's telling us is that the consumer beware, in a sense, of that the app is not the answer, but could it be perhaps one step in the gateway of saying, let me take a look, and this will allow me to at least evaluate myself, take a look and say a little bit deeper into my mood. And if that's the case, then link me with a clinician, but not to be a substitute, because that's when it can be really
And in
dangerous.
that context, working with that clinician or early on in some
Exactly.
of those
I
conditions.
sort of envision it as part of your team. Each team member is valuable. The apps can be a valuable team member. The diet can be a valuable team member. But if you rely solely on one and to the detriment of the others, we wind up in a tough spot.
That's a great point. Dr. Merham, I want to thank you as always for coming in, sharing your insights, and really help educating us about the role of these apps and how we maximize our mental health.
It's my pleasure, Dr. White. Always a pleasure to speak with you. Thank you so much for having me today.
Well, there you have it. Apps certainly can play a role in our mental health. As Dr. Merham said, you're all going online, checking them out, but what you want to do is not make that your sole strategy to address mental health issues. Most of these apps do not diagnose and treat disease. They can play a role, often a complementary role, in conjunction with your therapist and your doctor. The key is to recognize, as we talked about, that there's no physical health without mental health, and mental health apps can play a role in helping you maximize that overall health as part of a comprehensive strategy to help getting you in a better place. Thanks for watching.